The ever-shrinking world and the constantly reducing distances have greatly increased the scope of communicable diseases. To stay one step ahead of the threats, the quality of the samples collected for tests and their safe delivery to the laboratory cannot be compromised.
The present film is going to show you sample collection. The importance of right sample collection is that if your sample is collected properly in adequate amount, the result will be right and the detection of public health emergencies will be in time. Any type of inadequate sample collection, improper sample collection will result in incomplete diagnosis, and this will cause delay in diagnosing a public health emergency. In conditions like H1N1, which are spreading fast, these delays can prove very costly. This particular film will try to tell you how to minimize the delay, ensure the safety of the sample, and secure yourself from the harmful effect of these samples, which may be containing highly infectious virus and bacteria. I hope you will find this film quite educative and useful for you.
The standard equipment for sample collection includes lab data form, tongue depressors, polyester fiber-tipped applicators with plastic or wire shafts, collection vials with VTM, parafilm tape, absorbent paper, Ziploc plastic bag, rubber bands, vaccine carrier with frozen ice packs, and a marker for labeling the samples. VTM, or viral transport medium, is used for collection of samples for viral testing and isolation. For short periods before it is used in the field, VTM can be stored in the refrigerator at 4 degrees centigrade. For obtaining VTM, contact your state surveillance officer at IDSP. To collect any sample from a suspected patient, the medical worker must wear complete personal protective equipment, or PPE. Being in close proximity with the infection, PPE ensures their safety. Before starting sample collection, information regarding the patient and the sample should be filled in the lab data form. The vials need to be marked correctly and should correspond with the lab data forms. There are 3 kinds of samples: throat, nasal, and nasopharyngeal. Ensure that at least 2 of the 3 samples are collected from the suspected patient. While preparing for a throat swab, the medical worker must ensure that only sterile Dacron or rayon swabs are used. It should be noted that cotton or wooden swabs contain substances that inactivate certain virus, thereby hampering the PCR testing. When taking throat and nasal swabs, the swabs must be held correctly at all times. The swab should be placed between the thumb, the index and the middle finger. The shaft should be protruding beyond the fingers as if you were holding a pencil. Holding the swab incorrectly can injure the patient. Before starting, the medical worker should take the consent of the patient. For the ideal sample, it is important to collect the sample from the correct portion of the mouth. The patient should be asked to tilt their head at an angle of 45 degrees to ensure easier access for the swab. To collect the sample, hold the tongue out of the path of the swab with the help of the tongue depressor. Use a sweeping motion to swab the posterior pharyngeal wall and tonsillar pillars. To elevate the uvula, have the patient say "ah." Rotate the swab to ensure that sufficient sample is collected. Upon collection of the sample, retrieve the swab from the patient's mouth very carefully. Avoid any contact between the swab and the soft palate and ensure that the swab tip does not touch the tongue. After collecting the sample, discard the tongue depressor and immediately store the sample in the viral transport media. To store the sample, place the swab into the vial and break off the excess applicator shaft. Care has to be taken that the tip of the swab is completely immersed in the VTM. Once the swab is placed into the vial, it should be shut tightly. Seal the vial by applying parafilm tape along the cap. Nasal swab refers to collecting samples from the anterior turbinate inside the nostrils. Ask the patient to tilt their head backwards. Slowly insert the fine shafted polyester swab 3 to 4 centimeters into the nostril. Rotate the swab once to ensure that sufficient sample is collected and slowly retrieve the swab. Place the swab in the vial, shut the vial tightly and apply the parafilm tape to seal the vial. Measure the distance between the patient's nose and ear. The flexible fine shafted polyester swab would need to be inserted halfway through to collect the same. The patient's head should be tilted back for easier access. The swab should be slid straight towards the auditory pit and should be inserted at least 5 to 6 centimeters in adults to ensure that it reaches the posterior pharynx. Leave the swab in place for a few seconds. The swab should be withdrawn slowly with a rotating motion. Once out of the nostril, the swab should be placed into the VTM. Place the swab in the vial, shut the vial tightly and apply the parafilm tape to seal the vial. After collecting the samples, the gloves must be discarded. Hand sanitization must be performed and a fresh pair of gloves worn before starting the process of storing the samples. The lab data form should be neatly folded and secured in a Ziploc plastic bag. The sealed samples must be wrapped separately in absorbent paper and placed inside another Ziploc plastic bag. Following this, fasten the bags containing the vials and the data form together with the help of a rubber band. Once the samples are packed, they must be transported in a vaccine carrier containing frozen ice packs. Place the ice packs individually into the vaccine carrier and then place the packed samples in the area between the ice packs. Secure the vaccine carrier properly to guarantee the safety of the samples. The vaccine carrier used to transport the samples must not be reused to transport vaccines again. The medical worker must wear a fresh pair of gloves after performing hand sanitization while collecting and storing samples from multiple patients. While transporting samples of more than one patient, each sample should be packed separately in an extra Ziploc plastic bag before putting them in the vaccine carrier. In the case of international air shipping of the collected samples, every precaution must be exercised to follow the IATA global guidelines. A goods declaration certificate should accompany the sample if it is being airlifted. Samples after collection should be kept at 4 degrees centigrade and transported to the lab promptly within 48 hours. If there is an expected delay beyond 48 hours, the samples need to be stored at -70 degrees centigrade at a referral health facility or a medical college near you. Contact the State Surveillance Officer at IDSP for more information. Avoid repeated freezing or thawing of the samples. The freezer compartment of a refrigerator cannot be used for storing the sample, as this would render the sample completely useless. After the medical worker has collected, stored and transported the samples, they must follow the system of sanitizing their hands. This is important and must not be ignored, especially after handling infectious material. Before exiting the work area or the lab, the medical worker should ensure that their hands are sanitized. In addition, the personal protective equipment, PPE, must be properly discarded and disposed of. In order to ensure the standard of samples, they must be collected as soon as the infection is detected in the individual. Solving any problem depends on addressing the right questions. The correct specimen, properly stored and shipped, is extremely vital for successful laboratory tests that would help fight any hazard to the world. Let us now see how much we remember about how to take samples correctly. What samples are preferred for a patient suspected of influenza? Upper respiratory samples such as throat swab, nasopharyngeal swab and nasal swab are the preferred samples for testing influenza virus. What material should the swabs be made of for detecting influenza? Specimens should be collected only on swab with a synthetic tip such as polyester or Dacron and an aluminium or plastic shaft. Swab with cotton tips and wooden shafts are not recommended as these inactivate the virus. If a sample cannot be transported within 48 hours, what temperature should it be stored at? If the samples cannot be transported within 48 hours, they need to be stored at -70 degrees centigrade. Let us now do a quick recap of the sample collection process.